All right, so thank you everyone for attending. We've got Chelsea with us today from Care First that's going to talk about the Employee Assistance Programme. I can just ask everyone to make sure you've got your microphones muted and your cameras off just for the presentation. And then Chelsea said that she'll answer any questions at the end of the presentation. So I will hand over to you, Chelsea, let you do your introductions, and I'm looking forward to your presentation. Thank you.
Thank you very much. Hi everyone, I'm Chelsea. I'm one of the service managers at Care First, and I'm here to talk to you about your mental health and differences between mental health, mental illness, to talk about some of the stigmas around it and to give you guidance on how you can help yourself and help others when going through mental illness. So I'm going to share my screen, get my presentation up for you all. Okay, so as I said, my name is Chelsea. I'm one of the service managers, and I'm going to talk to you today through this mental health awareness presentation. Now, the presentation will take about 50 minutes, and then there'll be time at the end for a live Q&A session. The session today will talk about mental health and go through what is the definition of mental health. It will talk about the difference between mental health and mental illness. We'll talk about the knowledge of mental health, the stigmas around mental health, and I'll be here to give you some guidance on how to manage difficult situations related to mental health and how to help other people. I'll also go through a short awareness on Care First, how our services can help you with your mental health. As a reminder, I'm not clinically trained, so I won't be able to answer any clinical-based questions today. However, I will be able to give you our free phone line so that you can ring up and speak to our counsellors and ask them any of the clinical-based questions that you might have. Okay, so firstly, I want to take a look today at the facts behind mental health. Now, these facts that I'm going to show you on the screen now and go through have been supplied by Mind and have been supplied by the Mental Health Foundation. And these organisations are doing a lot of research behind mental health and how they impact young people. So the first fact is that 1 in 4 people in the UK will experience a mental health problem each year. Now, it's important to note that this is every year. This isn't a duration of somebody's life. This isn't across a lifetime or in a certain amount of years. It's every year 1 in 4 people in the UK will experience a mental health problem. The next is that mental illness led to the loss of 70 million working days in 2013. This was up by 24% since 2009. And I'm sure due to everything that's happened over the last couple of years with the pandemic, this has probably gone up a lot. This is a staggeringly high statistic, and it's all due to mental health. And this is why it's really important that companies like us at Care First are in place to give you the support that you need and to help you get back into work. Half the adults with mental health issues develop them before the age of 15 and 3/4 by the age of 18. This is again really staggering. This is a really high statistic, and that most people will already be concerned and having their mental health issues when they're young and developing. The next is suicidal thoughts occur at a rate of 17 in 100 people. And self-harm occurs at a rate of 3 in 100 people. Now, self-harm occurs at 3 in 100 people, and it's more likely that if somebody's going through self-harm thoughts or they're considering self-harming, they're then more likely to have suicidal thoughts and to consider committing suicide. It's important to remember that if someone you know is going through similar thoughts, or you feel they have suicidal tendencies, or they become a risk themselves, that you may feel that you need to call an ambulance, you need to call the emergency services, but it's important to note in these circumstances that the best service to call is the police, as they can actually do something about it. The emergency services aren't able to restrain somebody who's feeling suicidal, but the police can. You can also call us up at Care First and speak to our counsellors, and they can help you, give you advice in what support you can give. Now, of course, this is only extreme cases, but if someone is showing these signs or having these thoughts, the best thing you can do is call the emergency services. Looking at these or having these thoughts is the best thing to do is call the emergency services, and looking at all the facts on the board. This is why we need to make ourselves aware of how we can help people. and what we can do at Care First to assist you and how you can help people in these circumstances. You can also speak to those at your organisation, you can speak to your wellbeing team, you can speak to HR, you can speak to mental health first aiders or wellbeing champions as well, and they'll be able to give you that advice and support. Now, what is the difference between mental health and mental illness? Now, this is really important because there is a difference, and I think they often get blurred into one. And as I said at the start, there are a lot of stigmas around the both, so we're going to speak about that today. So mental health is something that we can all go through. Mental health focuses more around your mood and your sense of well-being, and your mood and your sense of well-being can constantly change. It doesn't remain constant and it's not consistent, and it can change as you go through different stages of your life and you go through different things in your life. But mental illness is slightly different. Mental illness can be defined as a health condition, and this health condition can change the way a person thinks, feels, and behaves. And it's often something that needs to be diagnosed by a health professional such as your doctor. Now, mental illness can be affected by chemical or circumstantial, and it can be, for example, someone suffering from postnatal depression, or it can be something to do with a chemical or hormonal imbalance. Circumstantial can be someone going through a bereavement, but mental health is your well-being as a whole, and illness is more a condition that is diagnosed by a doctor or healthcare professional. Now, this slide goes through where all of our knowledge may come from when it comes to do with mental health. Now, obviously, mental health can have a stigma about it, and people can perceive and understand mental health in different ways. And it's important that what you learn about is realistic and it's representative and it's accurate of what mental health is. And that's why we want to talk about it today. So this slide shows some of the areas that may influence our knowledge and understanding of mental health. So the first is newspapers. Now, obviously, there's a range of different newspapers out there, but we often see things in newspapers and they're often sensationalized and dramatized when they speak about what's going on. And the reports and the articles that they can write about mental health aren't always accurate or realistic, and they're not always representative either. For example, articles are often written about criminals. You'll see a lot of criminals, and when they talk about criminals or serial killers, people breaking the law, they'll then tie in things to do with mental health. And this is really often in articles that are written, and what it can do is produce that stigma around mental health and make people think that people who suffer from a mental illness, for example, are dangerous or are likely to break the law, when actually that's not necessarily true. There's also TV. There are a lot of TV documentaries and series at the moment about events that impact people's lives and in turn their mental health. Now, a lot of the TV that's broadcasted at the moment is documentaries, and it's getting more accurate in how they're relaying mental health. But some of the TV that you'd see in the 70s and the 80s really weren't accurate. And unfortunately, that can have an influence on how people view mental health. Fictional TV dramas like soap operas like Coronation Street and Hollyoaks and EastEnders, they'll often tie in stories as well to do with people suffering with their mental health or with a mental illness. But again, this is just a snapshot. It's a small snapshot into what somebody might go through when they're suffering with their mental health, and it's not always realistic or representative to do with mental health. There's your personal life. You may know somebody in your life that experiences mental health issues, or you yourself may have experienced mental health issues. It's good to take a minute to think about different experiences that you may have had to do with mental health. Everybody experiences mental health completely differently. And this can really shape your opinion and your knowledge about mental health. I think what I do know is that, for example, the way my parents view mental health can be very different to how I may view it. I have an older dad, he is nearly 70, and the way he views mental health is very, very different to how I do. And that's because when he was younger, he lived near Broadmoor, one of the mental health hospitals, and when he was younger, it was very criminalised, and there was a stigma that people who had mental health issues should be locked up and they should be behind bars and they were dangerous, when actually the knowledge that we have on it now is incredibly different, and the viewpoint we have is incredibly different. So the personal knowledge that somebody has can really change their viewpoint on mental health, and it's important to consider that when you're speaking to others about mental health, when you're supporting others, and when you're thinking about, is my knowledge, the knowledge I've got, the experiences I've had, is it correct? There's also media sources look at mental illness, and again, they can sensationalize it, they can dramatize it, and they often look at different cases too, like celebrities and individuals such as Amy Winehouse, Caroline Flack, unfortunately people that have been lost, and the media have put pressure on them to do with their mental health. However, there's also things like they talk about celebrities and the mental health they might be going through, but the difference between celebrities and people who aren't celebrities is that celebrities may have more support out there. They may be able to afford more support. There's also films as well. There are films out there that focus on mental health and mental illness. For example, the film Shutter Island with Leonardo DiCaprio. I'm not sure whether any of you have seen it, but that is a film that is out there, and again, that dramatizes it, and that talks about mental health, but it talks about somebody being shut on an island and an asylum, and it's not necessarily representative for the support that is out there and what somebody might actually be going through if they're going through mental health. Do have a think about some of the films you may have seen that show mental health that aren't exactly realistic. There's Fight Club, more recently The Joker, the new Joker film. These are hugely dramatized for being on the big screen, and they can influence others' perception when they watch the films about how they see mental health and mental illness, and it's not accurate and it's not representative at all, and it can add to that stigma behind it. But it's important to remember that if you're struggling with understanding certain aspects surrounding mental health, you can call us up at Care First and you can ask one of our accredited counsellors. They'll be able to talk to you about it. You can even visit different websites like Mind and the Mental Health Foundation Trust, and they've got lots of information to talk to you about mental health conditions, mental health concerns. You may have a good understanding, you may be having conversations with friends and family, and the subject of mental health comes up, but be sure to learn where you can and to educate where you can. A friend may have a certain perspective about mental health which you don't agree with or which differs to yours, but it's good to have those discussions and to ask them why they think differently to you. So let's go through some of the ways which you can recognise that somebody might be unwell. Now, it's important to note that these ways that I've got listed on the screen are seen as symptoms and ways that can highlight that somebody might be unwell. However, these can be symptoms of a physical illness as well as mental health. So it's important to remember that. So the first is poor motivation. This person may not be able to get up in the morning. They may feel like they don't have the energy to do things. Self-absorbed, this person may feel lethargic or fearful or being on edge or restless, but it may cause them to have lack of concentration, dramatic change in their personality. They may be worrying about themselves and overthinking about what comes next. Somebody may speak about suicidal thoughts. Obviously, this is an extreme case, but it is something that unfortunately is common if somebody has mental health concerns. It's something that you can support with and should listen to. They may become disorientated. They may not be able to focus on their everyday tasks that they once could focus on, such as doing work or doing everyday jobs that they might do at home, like the housework. They may be unresponsive or indifferent, so they may not engage when you're speaking to them. And if you ask them questions or ask them what's going on, they may not give you clear answers. Or they may not speak at all. They may not want to engage in anybody. The way they socialise may have changed. Poor personal presentations. They may take less time for themselves, less time for self-care. They may not feel they have the time, or they may find it overwhelming. Hyperactive or elevated. This can happen if somebody is feeling overwhelmed. And making comments indicating self-worthlessness. Now, this can be a trigger showing if somebody has low self-esteem or they're feeling worried. And this can be a mental health concern. And you can understand this if they're there making comments about their self-worth. They're judging themselves and being difficult to themselves. I've got some more on the next page as well. Lethargic. Somebody may be feeling lethargic, fearful. They may become restless and on edge, and this can be a sign of stress or anxiety. They may have poor concentration, the ability to focus and sit still, get through their everyday tasks. Lack of insight into their own behaviour, so they may not be aware of their own behaviour. A dramatic change of personalities, perhaps somebody who was once really bubbly and confident may now be quite quiet and not very sociable. They may be unsure. High risk taking, so this shows that they're not thinking things through, they're not preparing themselves. They're becoming perhaps erratic and taking risks and reckless. Becoming socially isolated. Now, the question you have to ask is have you thought about seeing your GP if you approach somebody with this kind of support? Make sure you help them with signposting them. So you could speak to them about, have they spoken to their GP? Have they thought about seeking support perhaps through Care First? It could be a family member, ask them if they could use the EAP, and signpost them very softly and carefully when you're giving them that support. Some of the signs could be like poor motivation and they're self-absorbed when normally they aren't. And it's important to take note of these things, but to be soft when you do help them and when you signpost them. So this slide is on the practical guidance and how you can help. So this demonstrates some of the ways you can help, and maybe you know somebody like a friend or a family member who's going through mental health concerns, or you know somebody who goes through a mental health illness and they've already been diagnosed and you're aware of it. It's important that if you're not aware and you're feeling concerned, that you get them to speak to you. The first one is really important. It's to remain calm and non-threatening. So if you speak to somebody who you feel concerned about, make sure that you allow them to open up and you ask a lot of questions, but you also allow them that time to speak when they're ready. Remain calm and remain open to listening to what they're saying. Make sure you take on board what they're saying. Don't try to disagree. It's really important that you're there for them and you show them that you can listen and hear what they're saying. If you're at work and you're a manager and you feel a member of your team is returning to work following a diagnosis, you could perhaps prepare for them returning to work. Be ready of the things you could talk to them about, maybe prepare the rest of the team and let them know that they could help to understand that person and remain calm and patient with that person. Obviously, only do this if you have the consent of the individual to tell the rest of the team, as it's their business. The next point would be to show your concern, try and reassure them with an empathetic response. Often with managers, when someone is struggling, the manager will go straight into problem-solving mode. But it can also be really helpful just to sit and listen to that individual and show concern for them and let them know that you're there for them. The next point I have on the board is be aware of what the HR policy is and what it says about supporting individuals with mental health issues. This is really important and you can speak to your HR and wellbeing team about this. Don't be afraid to do so. If you have questions, do speak to them and find out what they would suggest. You can also call us up at HR. We will know the HR policies as well. Call us up at Care First, we will know the HR policies that are in place. We'll be able to help you and give you advice in how to do that. What not to do is to give the individual that is struggling too much to think about. You know, we know that when someone is unwell or anxious, they tend not to be able to listen to what is being said to them, what advice is being given. So don't give them too much to think about. Instead, listen to what they're telling you. Perhaps maybe give them one piece of advice or signpost them to somebody who can give them that advice and who can help them when they're ready to be helped, when they're ready to do that. Try to stay calm and don't overload the individual with the information that you feel might help, that you feel helped you, for example. Just make sure that you're empathetic and that you're there to listen. That is most important. The next point is try to reassure them. Reassurance is really good. Reassurance is really good for giving them that strength. Try to reassure them. Don't get immersed in the issues that they're going through. You have to think about yourself as well. You have to think about the effects it has on you. Listen to their issues, take on board what they're saying, and then offer them reassurance and empathy. And make sure that you offload any issues if you become immersed. Make sure that that person is safe. Don't try to reason with them who may be out of control. Just make sure that they're safe. Talk to them and understand what may be appropriate and maintain boundaries. This will make sure that you don't get too immersed in their issues. Perhaps this is where you could refer them to us at Care First, or you could refer them to the mental health and wellbeing team at your organisation, where you could refer them to HR or a mental health first aider, wellbeing champion as well. And this is ensuring that they're safe and that they have their safety blanket around them. Respond to reasonable requests whilst maintain boundaries. Yeah, that is exactly the same. Maintain those boundaries for you, but also make sure that they're safe as well. Now, we can look at ways to look after your own mental well-being. Perhaps it's you that's going through a mental well-being concern or a mental health issue rather than somebody else that you've been speaking to. Perhaps it's you who needs that extra support. And on this part of the presentation, we're going to go through that. So the first one is talk about your feelings. This is really important. Now, if you don't feel comfortable speaking to somebody at work or speaking to a team at work, this is where we come in at Care First. Now, we're completely external and it's completely confidential and free for staff to access. And you can ring up and speak to one of our counsellors, one of our professional accredited counsellors who can help you with what you might be going through. Or you can talk to loved ones like your friends or your family. This is really important to talk about how you're feeling, because it might be that those around you are able to give you really good advice. The reassurance that they give you might be enough to help you feel better. Or you might find that those around you are feeling the same. You know, they're feeling similar. And that can really help you to feel relate and to feel you included as well and other people around you. Keep active. Now, this is really, really important if you're not feeling well and you're feeling overwhelmed or you're feeling stressed. A small part of activity, each perhaps a day or a week, can help you to feel more on top of what you're doing, and it can help you to unwind. Even if you just go for a 10-minute walk once a day, perhaps on your lunch break, that can really help you to unwind and feel less stressed. You know, looking after your well-being is key. If you're struggling with your mental health, and activity can be a part of that, so can your diet and your nutrition. Drink sensibly. I think we're all partial to having a drink, say an alcoholic drink, if we're feeling quite overwhelmed or we're struggling with our mental health or feeling stressed. But make sure you drink sensibly. It's okay to have a drink now and again if you're feeling like a drink can numb how you're feeling and it's something that you enjoy doing, but make sure you do it in moderation and make sure you're thinking about your overall health and well-being as well. Eat well and healthily. Eating well and healthily and having a nutritional meal regularly can really help you to have that energy to keep that activity up and to keep your mood high as well. Look after your general well-being through regular hydration as well, by drinking water regularly, and they're really important for helping you look after your mental health. Keep in touch with people who matter to you. So keep in touch with your friends and family. And don't be afraid to give them a call or message them or meet them for a coffee or a lunch and speak to them about how you're feeling. Even if you just say to them, do you know what, I'm having a bit of a hard time at the moment. You know, sometimes that's enough to help you to relay and to help you talk about your feelings. And the people who matter to you are there to care for you, and they can really talk to you. They could even help with signposting you, or they can just give you reassurance when you're not feeling sure. But don't be afraid to reach out. Make sure you ask for help. Again, speak to loved ones, speak to those around you and ask for help. I think people do become frightened of asking for help sometimes. But if you're feeling like you're not yourself and you're really concerned about your mental well-being, there's so many places you can go to ask for help. You can speak to loved ones and those around you. You can speak to your GP. You can speak to your HR or wellbeing team at your organisation. You can speak to your manager, and you can speak to us at Care First. There's lots of different places that you can seek that help. And these people are there to help you. They're there to help you when you're feeling unsure. They're not going to judge you. They're not going to put pressure on you. You should ask for help and not feel sure about it, especially if you speak to mental health professionals or a GP. That is what they're there for. And they have got the materials and the resources to be able to signpost you and give you additional help and support as you're ongoing with that mental health concern. Make sure you take regular breaks. Now, this is really important if you work full time or if you have a hobby or you're a volunteer and you're doing something that takes up a lot of your time. Make sure you take regular breaks, even if it's just a 10-minute break. These breaks will allow you to have the time to unwind, to have a breather and a break, and to almost reorganize what you're doing for the rest of the day. And that can be really helpful if you're feeling stressed or overwhelmed or exhausted. Having that break can allow you to have something to eat, to be active and do some exercise, or you could opt in to do something nice. Like if you have an hour break, you can go and meet up with a friend and have a coffee break. You can go and do something that takes your mind off work and the other things that you're doing. Remind yourself of the things that you are good at. You know, what are you good at? What do you enjoy? Perhaps through going through stress or your difficulties with your mental health, you've taken a step back from hobbies and interests that you usually like doing. Perhaps there are things that you regularly used to do and you've not had time to do. You should definitely have a think about ways that you can go back to doing those things you enjoy. Take that time out for you. Remind yourself of the things you are good at to help build up your self-esteem and your self-confidence. You know, what are the skills that you have? What is it that you're talented at? Definitely have a think about things that you can do and what you're good at. Be accepting of yourself and don't be too critical. This is really important. I think we all have moments at work or in our lives where we feel overwhelmed and we've got a lot going on. And you start to doubt yourself. You start to doubt your ability at your job. You start to doubt your ability at how you cope with everyday things. But you shouldn't do this because sometimes different things happen in your lives, different things change. Perhaps you're going through a particularly difficult time in your relationship or with your family or in your job. All of us have had moments where we feel overwhelmed, and it's important to do the best you can and be happy and okay with that. You know, it's okay to say no if you think, actually, somebody's asked me to do something else and I don't have the time, it's too much. Say no. That's completely okay. Don't be too critical. I tend to make lists every day of what I'm doing. I have a diary and I tend to make a list of what I'm doing and I write out what I'm doing, and then I'll do little circles of numbers of what's the highest priority. If it gets to the end of the day and I've not done it all, that's okay. We'll try again tomorrow and we'll push those aside to tomorrow and we'll try and do those tomorrow, but that's okay. It doesn't mean I'm not good at my job. It just means I've got a lot to do and I'm balancing how to do it, and that's completely okay. Care for others, though not to the detriment of yourself. Okay, yeah. So be there for others, support your friends, support your family when they need you there, but not to the detriment of yourself. If you're having a moment where you think, actually, I can't come over and see you, or I can't have visitors today, I'm too tired, I really just want some time on my own to relax, that's okay, say no. You have to put yourself first and make sure that you're looking after yourself before looking after other people. Now, I want to go through who we are at Care First and how you can access our service at Care First if you feel that you need that extra support. And as we've spoken about today, what mental health is, what mental illness is, how you can support others and how you can support yourself. Now, at Care First, we can be there to either support you or as a way to help you support others as well. Now, if you're not sure who Care First is, we provide the Employee Assistance Programme at Leeds Teaching Hospitals, and we are an investment that the organisation has made in order to provide support, mental health support for their staff. Now, we are completely free and confidential for all staff to access. You can access our service as often as you like, whenever you like. Now, I'm going to run through who we are at Care First, what services we provide, and how you can access those services if you feel you'd like some support. So in a nutshell, we provide professional counselling service as well as an information and advice service. And we're there to help you with issues in your personal life that you might be going through at home or in your work life, and things you might be experiencing in your job too. Now, we're here to complement the existing HR and management team at your organisation, and we work alongside the employment policies and procedures that are already in place. But one of the main benefits of using our service at Care First is that we're there to provide you with an opportunity to discuss your problems away from the organisation. So when you call up, our service is completely confidential and you're speaking to somebody who is completely external and who is not a part of the organisation. And we can give you advice that is completely independent of the situation that you're in. Now, how to use Care First. Now, if you'd like to use Care First, you can ring up our free phone line, and I will provide the free phone line at the end of the presentation today. Our free phone line is open 24/7 every day of the year if you feel you need that support. Now, you call up and you can speak to our counsellors as often as you like, whenever you like, whenever you like. Our counsellors are available 24/7 every day of the year, and they can give you in the moment support. Now, what's important about that is even if you're having a stressful time, or perhaps you can't sleep, it's 3 in the morning, you can ring up and we've got no reception, no triage. You'll go straight through to one of our BACP accredited counsellors who'll be there to help you on the line immediately with what it is you're going through. Now, when you need in the moment support, you can ring us up as often as you like. So say you phoned us up early in the morning because you couldn't sleep and you're having a difficulty later on that same day, please do call up again. Our counsellors are there to help you. Now, when you speak to our counsellors, they will be there to help you, but they may also suggest some different forms of support that they feel could be clinically appropriate and to help you with the issue you might be going through. Now, we can offer you up to 6 sessions of either telephone support or face-to-face counselling. It's important to note that this decision of whether it's clinically appropriate for you to have 6 sessions with us is left with the telephone counsellor on the line. It's not likely to happen on the initial call into the service, but if you ring up and speak to our counsellor and they decide actually what you're going through, you'd really benefit from some short-term support, then they may ask you to take place in a short HADS assessment, and this will give them the idea of whether to determine of whether those 6 sessions and short-term support is clinically appropriate for you. We also have our information specialist service. Now, our information specialists differ slightly from our counsellors. They're available on the same free phone line. However, to speak to our information specialists, you need to press 1. They're available Monday to Friday, 8 a.m. to 8 p.m. and they are trained by Citizens Advice, and they're there to help you with more practical advice and issues. So things such as financial well-being, housing, benefits, legal information, your rights, employment. They're there to help you with more practical issues and advice, and our counselling centre is there for that emotional support. Now, if you're feeling unsure about calling up and speak to one of our counsellors, you can go on our online counselling facility on our Lifestyle website. Now, you log into our online counselling service by going on the Lifestyle website. You log in using the Leeds Teaching Hospital username and password, which I'll give you at the end of the presentation, and you can click on the online counselling service. Now, this will take you to a web chat where you can speak to a member of our team. And when you speak to a member of our team, they'll give you that support and help you in making that call if you're feeling unsure. We also have a management support service. Now, this management support service is there for managers only, and our counsellors are trained to give managers advice and consultancy techniques when they're going through things in their organisation, such as changes in the workplace, or when they need help with effective workplace performance in their team or traumatic incidents. Our counsellors are there and can help. All a manager has to do is ring the free phone line and say to the counsellor on the line, I'm a manager looking for support, and they'll be able to help you. It's free and confidential like the rest of our service. We also have a mental health first aider or wellbeing champion support service, and this is there to help mental health first aiders if they've had a challenging or difficult conversation. We can also offer critical incident support if the organisation is going through a critical incident. So this is to run through the management support service. Now, the management support service does not substitute for the usual manager-employee relationship, but it is there as a way to support managers, and it's confidential and free, and you can speak to somebody who is completely external from the organisation. And our counsellors on the line can help with managing change, effective workplace performance, changes at work, consultancy advice and support, management referrals, and traumatic incidents. Now, as a manager, you have the ability to make a management referral, and you can make an informal management referral if you'd like to do so. Now, the benefit of this is a great way to help the members of your team. If you'd like to make an informal management referral, all you have to do is ring the free phone line whilst you're in the room with that member of the team who would like support. And what you can do is tell the counsellor you're making an informal referral, and the counsellor will tell you when it's appropriate to pass the phone over to that member of the team who needs support. You can then leave the room and have that member of the team have their support with us at Care First. Now, this is to run through our Care First information service. Now, as I said, our information specialists are available Monday to Friday, 8 a.m. to 8 p.m. And they're there to help you with a wide range of issues to do with financial well-being, benefits, housing, legal information, your rights. They're there for that practical advice and issues. They are confidential, and you can access them by ringing that free phone line as well. Now, as a reminder, our service is completely confidential. When you ring up our service, our counsellors or information specialists on the line will ask you what organisation you're from. Now, you'll need to tell them what organisation you're from. This is so they can have a look at what services are available for you, and they can make sure that you have the right support at hand. Now, to build rapport, they will ask you to provide your name. However, there's no pressure. You don't need to provide your name. You can remain anonymous, or you can provide a different name if you feel more comfortable doing so. However, I want you to feel rest assured that our service is completely confidential. And if you would like to provide your name, you can be rest assured that it is in confidence. Our confidentiality is only broken in 3 exceptional circumstances. The first is when there's a threat to the life of another person. The second, when there's child protection or vulnerable adult issues. And the third is when there's a risk to the security of the customer organisation. And in those circumstances, our confidentiality may be broken. Now, this is our Care First Lifestyle website. If you were interested in having a look, it is a hub full of material, so I would have a look. You can access it at work, at home, on your mobile, on the go, whenever you like. Now, to get on the Care First Lifestyle website, you will need the username and password for Leeds Teaching Hospitals, and I will provide that today. Now, once you've put in that username and password and have logged in, you'll be taken to this homepage. Now, this homepage shows you all the different things that are available. Now, on the right top hand corner there, you can connect and chat online with a Care First counsellor. This is our online counselling facility. When you click on there, you'll need to put in your organisation, and you'll need to put in your name as well, and you'll be able to speak to a member of our team who will assist you in making that call if you're feeling unsure. The top middle box is the helpline. If you'd like to speak to a counsellor, you can click on there and it will give you the number to call and take you through to the helpline. The bottom left tab is the Wellbeing Webinars and Articles area. Now, we've been creating webinars since the start of the pandemic, and there's over 100 weeks worth of webinars in there with supporting articles. And they cover your mental health and wellbeing. They cover the services at Care First, as well as things to do with COVID-19. But there's all the recordings in there, and they're permanently there. So if you'd like to have a look, you can click on there, have a scroll through. We've also got the budgeting calculator in the center at the bottom. Now, this is really good if you've got a goal. Say you're saving for a new car, or you want to buy your first house, or you're saving to move house. You can put in your monthly ingoings and outgoings, and it will give you a monthly budget to stick to and help you reach that goal. Again, this is free and confidential for you to access whenever you like. We've also got the bottom right corner there. This is information on your home finances and budget planning. Now, our information specialists can help you with budget planning if you'd like to call up as well. But you can also click on there and be taken to a software that we work with. It's MyEva, and you can have financial advice through MyEva, and they can help with budget planning too. We've also got sections for at home, at work, health and managers too along the top. And this is there to help you with specific materials and support for all those different circumstances, perhaps things you're going through in your personal life, things you're going through at work, and a separate managers area there too. Now, who are our counsellors when you call us up and speak to us? Now, all of our counsellors are professionally qualified with a minimum of a diploma level of training. They are all BACP accredited. We don't hire counsellors or work with counsellors unless they're BACP accredited. They're regularly DBS checked, and one of the great things about the counsellors that we work with is that they have extensive experience, and they come from a range of different backgrounds with personal qualities and organisational experience. And this is so that they can give you support that is tailored for you and that works for you. Okay, and we're coming to the end of my presentation today. As a reminder, before we go to questions, our counsellors are available 24 hours a day, every day of the year. Our free phone line is 0800 174 319. Our information specialists are available Monday to Friday, 8 a.m. to 8 p.m. You can access both by ringing that line. The service is free and confidential for all staff to use at Leeds Teaching Hospitals. You can also access the Lifestyle website at carefirst-lifestyle.co.uk, and all you need to log in is all lowercase Leeds Teaching, and the password is all lowercase hospitals. And once you've logged in and gone through, you'll be taken straight to that homepage and you'll be able to access all of that materials and the support that is there for you. And you can do this at home or at work, wherever you like. Great, thank you. I'll stop sharing now. We're open for any questions that people may have.
That's brilliant. Thank you so much for that, Chelsea. That was
That's okay,
really informative.
No problem.
Definitely filled me in on a lot of things. Yeah, so we'll open it up to questions now. Just as a reminder, obviously we're doing the generic questions, so if you've got anything, we are still recording on this one. As Chelsea said, obviously on a clinical side, she wouldn't be answering any of those, but if you do have any that is a bit more personal that you don't want in the recording, if you just want to hang fire, and then we can do those after I finish the recording. But yeah, I'll hand it over if you've got any questions, anybody?
It is quite a hefty presentation. I know it's a lot of information to take in. So if you do have any questions about the service, how to access the service, if you're not sure what the service is for, or about the mental health presentation, I can answer today.
Perfect. Martin, are you wanting to come in with something?
Yeah, I just wanted to clarify, you mentioned in the presentation that if you called up, there could be then, like the follow-up 6 sessions or what, that could be arranged, or face-to-face meetings. And you mentioned that that's basically a clinical decision. Is it just a clinical decision, or could someone potentially phoning up actually ask for that? How does that actually work in that sense?
That's a great question. Thank you, Martin. So what our process is you call up and you have that support in the moment with our counsellor. Now, if you call up and you call up a couple of times regarding the same issue and the counsellor on the line feels that you'd really benefit from structured support rather than in the moment support, that is when the counsellor would refer you and have an assessment with you. Our process is not likely that if somebody rings up and they say, I would like structured support, our counsellor will then talk them through what they're going through, and it would still end up the counsellor's decision. And they would then ask you to take place in that assessment, and then they'd be able to refer you to that structured support. But it's always down to that counsellor on the line, whether they think it's clinically appropriate. Thank you. Great question.
Thank you.
That's brilliant. Thank you for that. Does anyone else have any other questions? I'm going to take this. Oh, yeah, no, we've got Rachel. So we've got, can NHS workers, why can't I see that in the chat now?
Oh, I've got it. I've got
yeah.
it. Can NHS workers' family members use Care First? So our EAP service is not fully accessible for family members. However, what we can do is if you have a family member that needs support, as long as they're 18 and over or they're 16 and over and working, you can ring us up and speak to us about that family member, and we'll be able to signpost them to appropriate support, but we won't be able to support them ourselves. But thank you, that's a great question. That comes up regularly.
Brilliant, thank you. Do we have anything else, any others before I finish the recording of this? Like I say, if you've got something that is a bit more personal, we can do that after recording. But do we have any more I don't want to use the word generic, but more generic questions around Care First? No, I don't think we do. Right, so I'll stop the recording now.